When considering filing a claim for VA compensation, there are a few things to keep in mind. First, it's helpful to know what VA compensation is. Compensation is a monthly payment made by VA to a veteran or eligible family member because of a service-connected disability. There are various types of VA compensation, but let's begin with a look at disability compensation. A veteran may be entitled to disability compensation if he or she is disabled due to an injury or disease while in active military service. There are two important facts to note. The injury or disease must have been sustained in the line of military duty, or a pre-existing injury or disease must have been aggravated by military duty. Veterans may receive additional compensation if rated higher than 30% for one or more disabilities. For more information on VA compensation, visit benefits.va.gov and search compensation. If you've received a rating with multiple disabilities and wondered how VA got the combined percentage, the following information and example can help you understand. VA uses a concept called the whole person theory to determine a veteran's combined disability rating. This method ensures that a disability rating can never be greater than 100, since a person cannot be more than 100% able-bodied. The disability is determined by using the combined rating table located at 38 CFR 4.25. To use the rating table, you need to start with the highest disability percentage, and from there, arrange them in order of severity, highest to lowest. For example, if there are two disabilities evaluated 50 and 30% disabling, the highest degree or most severe disability, in this example 50%, will be found in the left column. Then, the other less severe disability, in this example 30%, will be found in the top row. The figures appearing in the space where the left column and top row intersect will represent the combined value of both disabilities. This combined value will then be converted to the nearest number divisible by 10. Remember, combined values ending in 5 or higher will be adjusted upward to the nearest number divisible by 10. Combined values ending in 4 or lower will be rounded down to the nearest number divisible by 10. The rounding is only done at the very end after all the disabilities have been combined. Let's begin with Joe Veteran as an example. Joe has been rated for the following disabilities in order of severity: 30% post-traumatic stress disorder, PTSD, 20% diabetes mellitus, 10% peripheral neuropathy. Joe has a combined rating of 50%. This combined rating was derived by the following method. Start with the greatest disability and then combine them using Table 1 in 38 CFR 4.25. First, take the 30% rating and find it in the left column. Then take the next highest disability, which is 20%, from the top row. The figures appearing in the space where the column and row intersect will represent the combined value of the two. The value is 44. Use this value for the left row, and then find the next disability on the top column, which is 10%. The figure appearing in that space where the column and row intersect is 50. Therefore, the combined evaluation for this veteran is 50%. For more information on combined ratings, see 38 CFR 4.25. For more information on VA
The advantages of using disability benefits questionnaires, or DBQs. Do you know that you can expedite your VA disability claim by submitting disability benefits questionnaires, or DBQs, along with your fully developed claim? DBQs are downloadable electronic forms created for veterans' use in the disability evaluation process. DBQs can help speed up the processing of your compensation or pension claim. Let's take a closer look. DBQs were developed to streamline the collection of medical information needed to process your disability claim. The forms use standardized medical terminology and checkboxes to quickly and accurately describe medical conditions. There are currently over 70 DBQs available that cover a range of physical and psychological disabilities. With DBQs, you may eliminate the need for a VA disability rating examination. Any healthcare provider with an active medical license can easily describe your symptoms in the terms VA needs to accurately evaluate and promptly decide your disability claim. Using a provider you're comfortable with and who has treated your disability in the past helps ensure that important medical information is included in your claim. While some DBQs are specific to a single medical condition, many forms can be used for several conditions related to the same organ or body system, such as heart conditions or respiratory conditions. Remember that VA will only accept DBQs prepared by healthcare providers with an active medical license. Healthcare providers completing DBQs must have sufficient medical expertise to conduct a thorough medical assessment for the type of DBQ completed. VA, of course, reserves the right to verify the data and authenticity of all DBQs completed by private healthcare providers, and in some cases, VA may still perform its own medical examination if additional medical evidence is needed. Licensed non-VA healthcare providers who can fill out these forms include physician assistants, nurse practitioners, physicians, psychiatrists, and psychologists. Your healthcare provider can fill out the DBQs electronically or by hand. Legibility is important. If your healthcare provider completes the DBQ by hand, VA must be able to read the information. Once completed, providers may mail or securely fax the paper DBQ to one of 2 VA evidence intake centers based on where you live. Your accredited Veteran Service Officer or VSO representative may also submit completed DBQs directly to the appropriate VA evidence intake center. However, to receive the fastest claim processing possible, VA recommends that you submit DBQs as part of a fully developed claim or FDC. An FDC submitted with a DBQ is the best way for veterans and survivors to get the fastest decisions possible on their VA claims. You simply submit all the supporting evidence, including the DBQ, with your application and certify that you have no more evidence to submit. Submitting a DBQ with your FDC may eliminate the need for a VA medical exam since DBQs are derived directly from the disability rating criteria in the VA schedule for rating disabilities. DBQs provide VA rating specialists with the information they need to evaluate your disability claim. A complete and accurate DBQ may significantly reduce the amount of time it takes VA to process your claim. When filing an electronic FDC for disability compensation through eBenefits, any DBQs you complete should be scanned and uploaded with your claim. If you are filing a paper FDC, submit any completed DBQs along with the rest of your claim package. You are strongly encouraged to work with your VSO representative. A VSO representative can assist you with identifying the appropriate DBQ to ensure that you successfully submit a fully developed claim. To learn more about VA's FDC program, visit www.benefits.va.gov/FDC or go to VBA's Media and Publications page at benefits.va.gov/benefits/media-publications.asp to access a library of related materials and videos. To help make the
Did you know, as the spouse, child, or parent of a veteran or service member, you may qualify for many types of VA benefits? Did you know this may include comprehensive health care benefits and affordable dental coverage? Did you know VA may help you or your children attend a four-year college, go to vocational school, or receive career training? As the loved one of a veteran or service member, you shared in his or her service and sacrifice, and you may have earned VA benefits. Monthly payments may be provided if your loved one died while on duty or from a service-connected disability. If you're a surviving spouse or child of a wartime veteran with limited means, a VA pension may supplement your income. The cost of health care may also be covered if you qualify for the Civilian Health and Medical Program of VA. CHAMP VA reimburses you for doctor's visits, mental health care, prescriptions, and many other services. And if you or your children qualify, VA assistance can pay all or some costs of college, trade school, or on-the-job training.
As the spouse of a deceased veteran, you may have access to a VA guaranteed home loan.
VA burial benefits and other services may be available to spouses and dependent children, even if the veteran is still living. You supported the veteran or service member in your life. Now VA stands ready to support you. Explore VA today.
This week on VA News, we have these stories and more.
Acting Secretary Gibson spells out the problems before the Senate confirms Secretary McDonald.
There is one or more of these wonderful people in every VA healthcare facility.
And DoD and VA experts talk about the combined effort to mend our wounded warriors.
Hello, I'm Kaala Lovett with the Employee Education System.
And I'm Thomas Middleton with the Office of Diversity and Inclusion. This is VA News.
The Senate had not yet confirmed Robert McDonald as we were wrapping up production of this VA News. The Senate Veterans Affairs Committee held the confirmation hearing on July 22nd. McDonald is the former Procter & Gamble CEO and president. He said he would make every effort to right the VA ship as quickly as possible.
If confirmed, on day one, I will lay out my leadership vision directly to all VA employees. My charge will be to provide veterans the care that they have earned in the most effective way possible. I will ask VA employees to join me in reconfirming our commitment to VA's mission and core values.
Acting Secretary Sloan Gibson remained on the road, meeting with medical center leaders, employees, and the media, discussing changes in the works. On July 22nd, the day of the confirmation hearing, the acting secretary was in St. Louis to address the Veterans of Foreign Wars Summer Convention, meet with the media and employees at St. Louis VA Medical Center. Acting Secretary Gibson gave a full accounting of the steps being taken to improve hospital waiting times and other problems.
First and foremost, using available resources to get veterans off wait lists and into clinics. At the same time, we work to fix our scheduling system. Second, but simultaneously, our changes in leadership, addressing the VA's cultural issues, holding people accountable for willful misconduct or management negligence, and creating an environment of openness and transparency. And then third, the resource challenge, making the compelling case for the resources needed to consistently deliver timely, high-quality health care. Those are our priorities.
Former Army Staff Sergeant Ryan Pitts was awarded the Medal of Honor by President Obama on July 21st, just 8 days past the 6th anniversary of one of the deadliest battles of war in Afghanistan. Critically wounded, the New Hampshire father of one crawled through rocket fire and held off more than 200 Taliban fighters for almost 2 hours until support arrived. Although he has been out of the Army since 2009, he continues his mission to ensure 9 fellow soldiers who died on July 13, 2009 at Observation Post Topside and Vehicle Patrol Base Khaler in Wanat, Afghanistan are the real heroes and never forgotten. He will keep the nation's highest honor in memory of his fallen friends and comrades.
This medal, Ryan says, is an opportunity to tell our story. There was valor everywhere, according to Ryan. And so today we also pay tribute to all who served with such valor that day, shielding their wounded buddies with their own bodies, picking up unexploded missiles with their hands and carrying them away, running through the gunfire to reinforce that post, fighting through their injuries and never giving up. Helicopter pilots and medevac crews who came in under heavy fire. Said one soldier, "Never in my career have I seen such bravery and sacrifice." This is the story Ryan wants us to remember. Soldiers who loved each other like brothers and who fought for each other, and families who've made a sacrifice that our nation must never forget. Ryan says, I think we owe it to them to live lives worthy of their sacrifice. And he's absolutely right. It's not bad to stand up on this one.
Leading experts from the Departments of Defense and Veteran Affairs recently shared discoveries and best practices in caring for service members who have lost limbs.
At the National VHA Conference Center in Crystal City, Virginia, they also showed off the newest in prosthetics and discussed future upgrades in technology. The three-day symposium gave hundreds of warfighters with amputation, like Lieutenant Commander John Puccio, or Pooch as he likes to be called, the opportunity to talk about the progress in transplant and prosthetic technology.
The symposium is about connecting the dots between the technology and patient care. As technology advances, people sometimes don't understand that patient care has to follow or change to accommodate for the technology. There's always a new way of doing things, a better way of doing things, and what really has to happen first is the providers have to get on board with the technology, understand it completely, so they can tell their patients how to appropriately use it. If that does not occur, then what you have is a lot of expensive equipment that nobody knows how to use. And that is not what the goal. So the goal is to get the dots connected and the technology advancing at the rate of patient care.
More than 1,600 warfighters have lost limbs as a result of the wars in Iraq and Afghanistan.
There are more than 100,000 dedicated and very generous people who provide the priceless gift of their time, helping to deliver care and goodness to our nation's veterans. Staff at almost any VA facility can point out a volunteer who stands out, someone that everyone knows and who brings many smiles to many faces every day.
How are you? Good morning, good morning. Good morning. Speedy, speedy, speedy. Good morning. Well, when you come in the front door, you see me. And you ask me questions if you're lost. Good morning. Good morning, good morning.
Charles is the face of the Miami VA, as far as I'm sure our veterans would answer. He helps patients maneuver throughout the halls. Currently, we're having a construction improvement halls and walls project, and without Charles being in the intersections, if you will, of our facility, our patients would not be able to get to where they need to go in a timely manner.
May I help you tonight? Come on, may I help you? Clinic. What clinic? Diabetic. All the way down to the end and make a love. I say that's the greatest thing in my life I ever did in my life was go in the military and get out alive. Because the VA really takes care of me.
Well, as a veteran myself, I recall the first time I walked into a VA facility and I was scared. I didn't know what to expect.
When they come to that front door, they're worried, they're depressed, they're angry, until they talk to me. When they talk to me, they see a little purpose in life, I guess, I don't know.
Well, it made me feel better and more relaxed that, yes, I could maneuver through this big facility.
It's up to me. I'm a volunteer. As long as I get here and do something, that's the main thing, to do something to help the vets. And that's what I want to do, help the vets.
If I had a VA voluntary service cloning machine, I would put Charles in it and just spit them out, spit them out.
Former VA prosthetics chief Fred Downs is on the cover of the summer 2014 edition of VA Research Currents, the magazine about incredible research news being made at VA. Downs spent almost 40 years with a non-functional arm with a hook on it before technology caught up with him and the thousands of warriors who lost limbs in war. He wept with pride the first time he put on the DECA arm. The Current's cover story is on the FDA approval of the DECA arm. Ironically, the approval comes as prosthesis technology is surpassing the DECA and other superb products. Also in this summer edition of Currents, there are other fascinating articles like the one on VA's PTSD Coach, a smartphone app that pleases 9 out of 10 users. How VA has reduced the risk of cavities in veterans by improving its delivery of preventive fluoride. On the rise in the rare but real cases of breast cancer in males. A look ahead at the future of rehabilitation research from experts who share perspectives of what has been and what is to come. There's an article on studying the impact of computers in the exam room. Another on a cardiologist who believes he's developed a better way to implant a coronary stent, giving amputees more options for footwear, even high heels on a new prosthetic foot. A brief look at VA's new Chief Research and Development Officer, Dr. Tim O'Leary, and tracking eye movements to maybe help diagnose otherwise invisible traumatic brain injury. There's more, and you can read and even view a video or two at links in the summer 2014 Research Currents. Just read or download the PDF file at the address on the screen for some very intriguing information on work going on at the Department of Veterans Affairs.
Did you know? VA's 151 medical centers have been named to the 2014's Most Wired Hospitals list. The second year in a row, all have made the list. Here is VHA Assistant Deputy Undersecretary for Informatics and Analytics, Gail Graham, receiving the award. That's former VA Undersecretary for Health, Dr. Jonathan Perlin, on her left. Dr. Perlin is the president of the Hospital Corporation of America and president-elect of the American Hospital Corporation. According to the Most Wired List report in Current Hospitals and Health Networks magazine, while 375 healthcare facilities were named as core Most Wired winners, VA was among the 20 to exceed core IT development, integrating IT and patient-centered care, designating it as the Most Wired Advanced recipient. Hospitals and Health Networks develops and releases the list in partnership with McKesson, the College of Healthcare Information Management Executives, and the American Hospital Association. It is the result of a national survey aimed at ranking hospitals that are leveraging health information technology in new and innovative ways.
That's all we have for this show. Thanks for watching. I'm Thomas Middleton.
And I'm Kaala Lovett. Wishing you all the best in all of your endeavors. Have a great day and a super week.